Hi everyone, welcome back to the channel. I'm super excited to be here again. I didn't realize how challenging it can be to be consistent with creating content, especially in the beginning of a YouTube channel. So I'm gonna start working to become a little more consistent and present some fascinating new material that I've been learning in my own journey. So in today's video, I want to talk a little bit about something called a still point, and also go through some nervous system anatomy and physiology, and why we do still points in body work and in breath work practice. So I'm really excited to present this. These are two topics I'm really passionate about, which is the nervous system and also breath work practice. They've been both really transformational in my own life and learning how to find balance within. And so today is mostly about the still points, and the next video will be breathwork practice, where I'll teach you as well how to go through just some basic breathing exercises to regulate the nervous system. So today we're going to go through what is a still point, and we're also going to go through something called sensory afferent and efferent pathways. We'll have a short discussion on the autonomic nervous system, and then how to do still point work. And you could practice this, that anyone can do a still point. So even if you're not in manual therapy or a practicing practitioner, you can still use this information and use it on friends and family. And then we'll have a short topic on the breath of life and presence in practice. So a little bit about me, you probably know from the first video, I was a paramedic in the start of my career, and I quickly learned that I wasn't really well suited for it. I was a little bit too sensitive, and I was always taught as a child that sensitivity, it needs to be worked on. But now in my adult life, the sensitivity is a gift. And it's what helps me feel with people even more deeply. So I then went back to university and I studied to become a manual therapist. And I graduated in 2009, also in Vancouver, British Columbia. And then I continued my journey. So I studied with a lot of mentors, and I continue to do so. I believe in continuous improvement and education. And the body, you can spend lifetimes just studying one system of the body. So a mention of some of my teachers, Dr. Kelly Ambrosio, Natalie Rao, who was my first myofascial teacher. And then some more of the somatic perspectives. I've really enjoyed work from Dr. Raja Selvam, and then also Dr. Aileen Lapierre, who created something called neuroaffective touch, which is an amazing modality. And then I've also done more studies in myofascial, craniosacral, integral somatic psychology, and I have quite a bit of a history with teaching. I love teaching. It's something in me that just really enjoys sharing. So what is a still point? And it's a term most people haven't heard of, but a still point is a therapeutic pause in the motion of the craniosacral system. It allows the body to reset, release tension, and then also restore balance. And this principle was first described by someone named Dr. William Sutherland, who was an osteopath, like a founder in osteopathy. And he was the one that discovered this still point in the body that happens. And it's like a factory reset for the body. I also really enjoy when things have been looked at through a scientific lens, and there's been a lot of studies on still points. And one really cool study that I'd like to share is when they did a study with patients with dementia. And around 5 p.m. or when the sun begins to go down, people with dementia generally get really agitated. And so they did this study where they induced still points in these dementia patients and then measured their degree of excitement or agitation, and also their sleeping patterns. And it significantly reduced both the agitation and it improved the sleep. And so there is a lot of scientific literature on these still points. And so it's not just out there stuff that hasn't been proven. There is a real therapeutic value in finding still points. So if you are a manual therapist, and most likely if you're following this channel, you do work with the body, I want to talk a little bit about when you would do a still point. And so in my experience, I always do still points when I start and finish my sessions, or when I feel something known as the sympathetic buzz. So the sympathetic chain runs from T1 down to about L2, and it's the location of the majority of the sympathetic nervous system. So when I'm palpating and I'm feeling down the thoracic spine, oftentimes as you get more sensitive in your hands, you can feel something called the sympathetic buzz. And it'll feel like that part of the body sort of buzzing. That would be a great indication for still point work. I also use it when I'm just me and a patient are getting familiar, and I'm trying to create an environment of safety, which is so important if you would like to go into some more of the somatic dialoguing, breath work as well. The environment of safety is so important. And then I also do it as a tool for co-regulation. So as a practitioner, if I'm feeling a little bit out of balance, I would definitely go into a still point with the patient so that our nervous systems can regulate together. So let's talk a little bit about the nervous system. And I want to go through just the basics. And so we're going to talk about the sympathetic, parasympathetic, afferent signals, ignition switches in the autonomic nervous system, and then signs and symptoms of dysregulation. So someone who's out of balance, what does that look like? So there's a lot of information on the nervous system now, and people are really talking about it. How's your nervous system doing? Or my nervous system feels out of balance. The collective generally is actually quite informed on the nervous system, which is amazing. So these are the basics. So maybe just a review. The central nervous system, the CNS, is made up of the brain and the spinal cord. And then the parasympathetic nervous system is made up of the spinal nerves branching from the spinal cord, and it transmits signals between the brain, the body, and the internal organs. And then we have something called afferent signals and efferent signals. So the one I'm really interested in is these afferent pathways, which carry information from the body to the brain. So it carries sensation signals and it takes it to the brain for interpretation. And then efferent signals are mostly motor signals that come from the brain, exit the brain, and then go to move the area of the body. So the parasympathetic nervous system originates, generally, there's a lot of branches of information at the occiput and then also at the sacrum. This is called craniosacral outflow. So the cranial nerves involved in the parasympathetic nervous system are the oculomotor. So it's contraction of the pupils and dilation of the pupils. The facial nerve, which is mostly to do with tear production, salivation, and then the mucous membranes. We have the glossopharyngeal nerve, and then we also have the vagus, which is the primary parasympathetic nervous system nerve. So a lot of people know about the vagus nerve. Dr. Stephen Porges in polyvagal theory has done so much research on it. And there's a lot of tools we can do to influence the vagus nerve. And it has a real direct effect on the parasympathetic and the sympathetic nervous system. So let's talk a little bit about the sympathetic, okay? So the sympathetic nervous system controls the heart rate, it dilates the pupils, it increases the respiration, it inhibits digestion, and then it prepares the muscles and the body for quick action. So it's sort of that getting ready to pounce, the sympathetic nervous system. So it's the fight in the part of the nervous system. It's really affected by psychological and physiological factors such as stress and exercise. And then the real key here, something I found super fascinating, is that the sympathetic nervous system lies between T1 and L2, known as the sympathetic chain. And then there's a lot of ganglia along that area that go to specific organs. And so I think that's really fascinating if we're doing palpation. Down the thoracic spine, along the sympathetic chain, and you notice an area. So let's say it is T9. So you get down to T9 and you feel like it's hypertonic. It would open the question of, well, what does that segment innervate in the body? I can't pull it up right now, but let's say that it's the large intestine. Then you ask the patient, do you have issues with digestion, constipation, constant diarrhea? And they would most likely answer yes, and you could help them understand the part of the nervous system there. So these pathways of afferent and efferent divisions are really important in regards to still point, because we need to understand the nervous system and why we're doing still points. What happens in the body when trauma occurs, both emotional and physical, is that we tend to shut down our afferent pathways. So we don't have the ability to feel sensation as much, or we have a hyper awareness of sensation. So it can go both ways. What I see the most commonly when people land on my treatment table is that they close down the afferent pathway, and it primarily happens at the brainstem. So they'll be locked like this, or they'll be sort of like this with the head up. And so it's just showing that this whole suboccipital space is closed with body armoring so that they don't have the capacity to feel as much, maybe for good reason. And so a lot of the work in the somatic area is to help people open up these places so that the body can be heard, so that the mind can send the signals to the body properly, and that homeostasis can be brought back to the body. So another really fascinating area that I'll just briefly touch on here is called ignition switches. And there's 10 primary ignition switches in DMM, the training program I run. And I'll just go through the 10. And so there's one at the cranial base, there's one at the throat, the heart, the lungs, the stomach, the liver, the small intestine, the large intestine, the rectum, and then the sexual organs. And so through my experience working with the body, gentle touch and still point work along these ignition switches can really help the patient find regulation in the body. Also, the charges that get released through them is quite powerful sometimes. And that's when you'll see a lot of times on social media, this work is becoming more visible now, and it's so good. But when you see someone begin to sort of shake, or you see someone begin to sort of start moving the body in these very intuitive different ways, these ignition switches are being sort of lit up, and then it helps disperse the energy that's been held in that area for so long. And then a lot of times beautiful emotional releases happen along these ignition switches. So two terms also that I really enjoy are called interoception and exteroception. So interoception refers to the body's ability to interpret internal sensations, so such as hunger, thirst, the breath, the heart rate, tension, temperature, and emotional shifts. So it's your ability to feel into your own soma, your ability to feel what's occurring in your body. And I use this as a daily practice of checking in with my interoception. How am I feeling internally right now? Do I have the capacity to feel my heart rate, my lungs expanding, my gastrointestinal system working? And then exteroception. So it's the external perception of the world. So things like touch, sound, sight, smell, and temperature. So these are the two qualities that we work with when we're doing work in still points. And you can always teach your patients about these interoception and exteroceptive qualities. So I wonder, what are some signs of a dysregulated nervous system? I think even before we get into what is dysregulation, it's really important to mention that dysregulation is not the enemy. We all go through states and times of dysregulation, and it's totally normal. And so a lot of people pathologize it, and they begin to think that, oh man, I'm not regulated, I better do some breath work, I better do some somatic release. And they're amazing tools to use when you can't get out of a dysregulated state. But when we're dysregulated, we also get more access to the deeper wounds and the emotional burdens that we carry. And so there's a real value in safely being in dysregulation. Also, when you're with a person that is skilled in handling it. And so I just wanted to say before I even mention this that dysregulation is not the enemy. Ideally, we are regulated most of the time, but there's still a lot of value in dysregulation. And what does dysregulation look like? So what I see in my practice when a nervous system is very out of balance is that there'll be chronic anxiety and panic. There'll be mood swings and irritability, an inability to focus, difficulty with energy levels. There'll be chronic muscle tension, usually in the neck and shoulders. So the neck and shoulders will be quite lifted up, and the patients aren't even aware of it usually because those pathways of the efferent and efferent divisions are compromised. There'll be hypervigilance. So always looking out for danger, real sensitivity to noise. Or sometimes there'll be a bit more of a shutdown state. So there'll be numbness and detachment. So those are all some signs of dysregulation in the nervous system. So let's move into a little bit of the therapeutic value now of getting a still point. And so we talked a little bit about in the beginning there, what is a still point? And it's a moment of deep stillness in the craniosacral system. So still points are found usually at the base of the occiput, and you can also do a still point at the feet. When you hold the feet, and then it's a gentle inward pressure with the thumbs. And then you'll begin to feel the body start to push out. But what you do is you just gently hold your internal pressure, and then you wait for the pause to happen. And it can take 5, 10, 15 minutes to get into a still point. So it's a real great experience for the practitioner because the co-regulation of the nervous system needs to happen So the practitioner needs to almost be in a still point themselves. And then what happens is the nervous systems will begin to sort of co-regulate and then come into balance at a still point. And I think that's so fascinating how the nervous systems match each other. And so I just thought I would share that term of co-regulation. It's really, really an important thing for all of us. We don't heal by ourselves all the time. We heal with others. We heal in circles and not lines. So again, this is just an introduction to the still point techniques. And if you would like to learn more and actually begin to sort of study this, I want to just encourage you to visit the website, which is lionsbreathwellness.com.au. I have a training program where I'm teaching practitioners how to access still points, co-regulation, how to open conversations with your clients, and then also teaching therapists how to incorporate breath work into their practice. And so if you're interested, you can add me on Instagram, which is Lions Breath Wellness, or visit the website and we can set up a meeting and have a chat. And if not, if you're just here for the content, that's perfect too. So that closes the lecture on still points in the nervous system. I hope I gave you a couple tidbits or just some things to think about that you could use in your daily life. And so I will leave it at that. Thank you for your attention and making it to the end of this video. I hope you're doing amazing, and I'm going to be trying to do weekly videos now. So hopefully we'll see each other and make a comment. I'm trying to build this community up now. So thank you for your attention. I'll see you in the next video. Bye, everyone.